There's this one phrase, just 5 simple words, and I'm willing to bet that almost every single person listening has heard it at some point.
Oh, absolutely. It's everywhere.
Maybe you were at a dinner party and things got a little tense, or maybe in a work
In
meeting.
an HR seminar, that's a classic.
Right. Or, and this is where it gets really interesting, maybe you've actually said it yourself. It's usually delivered with this, warm, reassuring smile.
It's meant to de-escalate, to show you're one of the good ones.
Exactly. Someone looks you right in the eye and they say, "Oh, I don't see color. To me, we're all just human."
And boom, conversation over. It's the ultimate stopper. And on the surface, it really sounds like the goal, doesn't it? It sounds like what we're supposed to be aiming for.
It does. It feels like the moral high ground. Like, if
Yeah.
you don't see color, then prejudice can't exist. Problem solved.
We've reached the finish line.
But today, we're going to take that whole idea apart. We're doing a deep dive into some really fascinating work, specifically the frameworks developed by Dr. Shungu Hilda.
She's a chartered educational psychologist, and her take on this is, well, it's pretty revolutionary.
She basically argues that I don't see color isn't a badge of honor. It's actually a diagnostic marker for a very specific kind of problem.
It is. And what we're going to do today is walk you through her 6 stages framework. And you should think of this less like a dry academic theory
Right.
and more like a navigational map, a tool for understanding racial power dynamics in real time. We're going to pinpoint exactly where that phrase, "I don't see color," sits on this map.
And a little spoiler alert here, it is not on the good side of the map.
No, it is not.
Right.
We're going to unpack why this mindset, which Dr. Magadze actually calls stage connect 2, is such a massive block to genuine equity.
We're even going to get into the physiology of it, like what actually happens in your body when you hear someone say that.
The somatic response.
Yes.
And then, most importantly, we want this to be really practical. So we're going to give you the scripts, the actual words you can use to respond, depending on the situation.
That's the part that really got me. We have this binary way of thinking, You're either a bad person who's openly racist, or you're a good person who doesn't see color. But this framework suggests that not seeing color is the very thing preventing us from getting to the good stuff. It's a barrier.
It's a huge barrier. And the stakes, as we'll see, are so much higher than just an awkward moment at a party. We're going to look at a specific case study from the source material.
The one from the NHS?
The one from the NHS, the National Health Service in the UK.
Yeah.
And it shows how this seemingly innocent phrase can become a genuine safety risk.
Okay, so let's set that scene. This is a personal story from Dr. Magadza herself. She's at a medical appointment.
You know that feeling. You're the patient, you're vulnerable, you're in that paper gown.
All your professional confidence, your titles, it's all gone. You're just a person waiting for help.
Right. And she's speaking with a nurse. The context here is so important. The nurse is Romanian, working in the UK. So she's an immigrant herself, probably navigating her own set of biases and xenophobia.
So she's likely trying to find common ground.
Exactly. She wants to connect.
Yeah.
And the conversation turns to identity, which for a Black woman in the UK, it often does.
Yeah.
And the nurse just smiles and says it.
"Oh, I don't see color."
There it is. And the intention is so clear. When she's trying to say, don't worry, I'm not like them. I'm not prejudiced. I will treat you fairly. It's meant as an olive branch.
Of course. But the impact, that's where it all falls apart. Dr. Magadza describes this immediate internal tug of war. On one hand, there's the social pressure to just smile and nod, be the good patient, don't make a scene.
Especially as someone who's, about to stick a needle in you.
Exactly. But at the very same time, her nervous system is just flashing red. It's a danger signal.
And that's the paradox we need to unpack. Why would a phrase meant to be reassuring trigger a feeling of danger?
Yeah, if I'm the patient, shouldn't I be relieved? Shouldn't I think, oh, good, my nurse isn't racist?
Well, let's just follow the logic. If a healthcare provider tells you they don't see color, what's the immediate, terrifying follow-up question for a Black patient? It's, if you don't see my color, do you see my clinical risk? Do you see the data that shows how certain conditions affect people who look like me?
Oh, wow. Yeah, that lands hard. If you ignore the attribute, you're ignoring the medical reality that comes with it.
Precisely. We know for a fact that some conditions, like certain skin cancers or rashes, present differently on Black skin. We know there are huge systemic disparities in maternal mortality rates for Black women.
Pain management, sickle cell trait, the list goes on.
It does. So when the nurse says, I don't see your race, what the patient hears is, I don't see the specific biological and social factors that put you at risk. So instead of safety, you feel erased.
It's like having a doctor say, I don't see gender. Well, I need you to see my gender if you're going to check for cervical or prostate cancer. The context is everything.
That is a perfect analogy. You have to be seen in your full context to be treated safely and effectively.
Okay, so this is the perfect time to open up this framework. Dr. Magadz's diagnostic tool. It's a continuum, you said, from -6 to +6, like a thermometer.
A thermometer for racial literacy, yeah.
So where does our phrase, I don't see color, actually land on this thing?
It lands explicitly at stage -2. The title for this stage is Denial, Colorblindness, and Fragility.
-2. It's on the negative side of the axis. That's just...
Yeah.
It's fascinating because the people who say this, I guarantee you, they think they're at a +5 or +6.
Oh, they think they've graduated. They think they've transcended race entirely.
They think they're the most enlightened person in the room.
And that is the absolute defining feature of stage -2. Dr. Magadza describes the core belief here as, we're all just human. It's this idea that everyone starts from the same place, has the same chances.
And that talking about race is actually what creates the problem.
Yes. If we just stop talking about it, it'll magically disappear. It's a very idealistic but ultimately naive view.
This is the I don't see race, I only see souls crowd.
It is. And their self-image is incredibly important to them. They see themselves as fundamentally good people. So they prioritize what feels like harmony and niceness over what is actually true and specific.
Harmony over truth. That phrase really sticks with me. It's like, let's just all get along. Let's not bring up the messy, uncomfortable stuff.
It's a form of politeness that preserves the peace at the expense of healing the wound. Dr. Magadza calls this zone comfortably unaware or defensively avoidant.
They're allergic to discomfort.
Completely. And terrified of being seen as racist. So colorblindness becomes a shield. It's a protective mechanism. If I claim I don't see color, then you can't possibly accuse me of being biased based on color.
It's a defense for the speaker, not a comfort for the listener.
100%.
But okay, let's drill down on why the framework calls this actively harmful. Because if I'm listening, and maybe I've said this in the past, and let's be honest, I think I probably have years ago, I might be feeling a little defensive right now.
Of course.
I'm thinking, hey, my intentions were good. Why are you putting me on the negative side of the map?
And that defensiveness is right there in the title of the stage. Fragility. But let's look at the why. It all comes down to the gap between intention and impact.
Okay.
The intention, as we said, is kindness, connection, reassurance. But the impact is erasure.
Erasure. Let's break that down. What does that mean in this specific context?
The logic is pretty straightforward.
Yeah.
If you don't see race, you cannot see racism. It's impossible.
Right.
So by claiming colorblindness, what you are effectively saying is, I refuse to acknowledge the system that gives me advantages and gives you disadvantages based on race. You are invalidating the other person's entire lived reality.
That's a great analogy I heard once. It's like telling someone with a broken leg, oh, I don't see broken bones, I just see people.
Yes, that's perfect.
Doesn't help them heal. In fact, it means you're not going to offer them a crutch because you're denying the break even exists.
You're denying the injury because looking at the injury makes you uncomfortable. And this is what scholars sometimes call colorblind racism. It's a subtle form of gaslighting.
How so?
It forces the person experiencing racism to silence their own pain in order to maintain the social comfort of the person with more privilege.
So back to the nurse in the NHS story. She's protecting her own comfort, her own image as a good person.
And in doing so, she's basically telling the patient, let's just pretend the system treats us both the same, when they both know, deep down, that it doesn't.
She's centering her need to be seen as good over the patient's need to be seen as a whole person.
Exactly. And this brings us right back to the safety risk. This isn't just about hurt feelings. It has real-world consequences. And that brings us to the physical cost, to what's happening inside the body of the person who hears this.
Yes, the body check. This part of the research was so compelling for me. We think of these as just words, an intellectual exchange.
But they're not.
Yeah.
Dr. Magadza's work says the body keeps the score. The body reacts first, before the brain even catches up.
So she says we need to shift our focus away from the speaker and onto the recipient. What does that physiological response actually look like? If I'm sitting there in that doctor's office, what's happening to me?
The source describes some really common symptoms. A sudden tightness in your chest. Your heart starts beating faster. You might find you're clenching your jaw without even realizing it. Your breathing gets shallow.
It's a stress response.
It is a classic threat response. Your body is entering a state of survival, fight, flight, or freeze because it perceives a threat.
And I love that the framework is so clear about this. These are not personal failures. You are not being too sensitive or overreacting.
Absolutely not. These are ancient, hardwired survival strategies. Your body is detecting the threat of erasure, the threat that the person in power, your doctor, your boss, your teacher, does not see you fully.
And your body knows on a primal level that not being seen is dangerous.
It knows. The amygdala, your brain's little smoke detector, is going off. It's screaming, this person is not safe to be vulnerable with.
So the very first piece of advice in the framework isn't to think of a witty comeback. It's something you do internally first.
Yes. The body check. Before you even think about what to say, you have to regulate your own nervous system. Consciously soften your jaw. Take one deep breath. Feel your feet on the floor. Drop your shoulders.
You can't navigate a complex social dynamic if you're in survival mode.
You literally can't. You lose access to your prefrontal cortex, the part of your brain that handles reasoning and nuanced language. You have to calm the body to access the words. It's like they say on airplanes.
Secure your own oxygen mask first.
Exactly. If you try to educate someone while your own heart is pounding out of your chest, you're either going to snap at them or just completely shut down.
Okay, so we've diagnosed the problem. Stage number 2. We've talked about the physical cost. I want to zoom out for a second. We keep mentioning this map. If color blindness is at -2, what are the other stages? Give us the whole lay of the land.
Yeah. Seeing the whole continuum is really key. So let's visualize it like a ladder. We'll start at the very bottom, the most negative. Stage 6 is extremist leadership. This is organized ideological hate. People actively trying to create a hostile world for others. Dehumanization.
The absolute worst.
The absolute worst. Then you have stage 5, which is organized hate. These are the followers of that extremist ideology, the people who show up for the rallies. Moving up, stage 4 is overt bigotry. This is more individualized. It's using slurs, active discrimination, telling racist jokes. It's the kind of racism that's very easy to point at and condemn.
Right, that's the stuff that I think most people would agree is just flat out wrong.
Correct. But then it gets murkier. Stage 3 is defensive prejudice. This isn't a slur necessarily. This is the person who says, well, I'm just being honest, or complains endlessly about cancel culture.
Yeah.
They defend stereotypes as just, telling it like it is.
They feel like they're the ones being attacked for having an opinion.
Exactly. They feel victimized by progress. And then just one step up from that is our focus for today. Stage 2, denial and colorblindness.
It is truly wild that colorblindness is the next door neighbor to defensive prejudice. It's so much closer to bigotry than it is to allyship.
That is one of the most powerful insights of this framework.
Yeah.
It's closer because it shares the same root, denial, a refusal to accept the reality of systemic inequality. Stage Master 3 does it with anger, Stage Master 2 does it with a smile, but the outcome is the same. The system remains unchallenged.
Wow. Okay, what's next?
Right before we get to the positive side, there's Stage Master 1, unaware, disengaged. This is the person who says, it just doesn't affect me, or I don't really follow politics. There's a vague sense that something's wrong, but they just check out.
It's apathy, basically.
A kind of protective apathy. And then we get to the pivot point. Stage 0, Dr. Magadza calls this conscious awareness.
The on-the-fence stage.
Exactly. You're waking up, you see the problem now, but you are absolutely terrified of saying or doing the wrong thing. So you often just freeze. You stay silent.
I think so many well-intentioned people live right there in stage 0. They're paralyzed by the fear of messing up.
It is a very, very common place to get stuck. But the goal is to push through that fear into the positive axis. Stage +1 is curious and reflective. You start doing the work. You're reading. You're listening to deep dives like this one. You start to notice your own defensiveness. You're trying, but you're still clumsy.
The learner's permit phase.
Perfect. Then stage +2 is intentional ally. You're moving from just learning to actually doing. You're trying out the scripts. You're willing to apologize and learn when you inevitably get it wrong.
And stage +3.
Active ally. Now, you're not just practicing on your own. You're actively naming harm when you see it. You're taking social risks to advocate for equity. You're speaking up in the meeting even when your voice shakes.
And the top of the ladder.
Stages +4 to +6 are all about systemic change. This is where you move beyond individual interactions and start changing the system itself. You're rewriting the hiring policy, you're changing the school curriculum, you're embedding equity into the budget, you're using your power to change the structure.
Okay. Seeing that whole map, it really reframes stage 2. It's not the bottom, but it is a massive bottleneck, isn't it?
Yeah, it's a huge bottleneck.
Yeah.
You cannot get to stage +1 to curiosity. if you are stuck in the denial of stage natives 2. You simply cannot solve a problem that you refuse to see.
So let's get super practical. I'm listening. I've done my body check. I've taken a breath. Someone just said it to me. What do I do?
This is the best part of the framework. It doesn't give you one magic bullet. It offers stage-matched responses.
Meaning,
your response should be tailored to your energy level, your safety in that moment, and your relationship with the person. It's not one size fits all.
I love that. It gives you permission to not have to be a full-time educator. Sometimes you just need to survive the family dinner. Okay, so let's walk through them. Strategy number 1 is the gentle curiosity approach.
Right. You use this when it's a valued relationship, a friend, a family member, a colleague you genuinely respect. You assess that they're in stage 82, comfortably unaware, not malicious. And this is the most important part. You actually have the energy for it.
You're not running on empty. Okay, so what's the script? How do you say something without making them immediately throw up a defensive wall?
You lead with validation. You use I statements to lower their defenses. The script in the source material is something like, I know when people say, I don't see color, they usually mean they treat everyone the same. And I really appreciate that.
Okay, so you start by acknowledging their good intention. That's disarming.
It is. It stops them from spiraling into shame. Then you pivot. But for me, as a insert your identity, I actually need you to see my color to understand my full experience.
Oh, that's good. I need you to see it. It's not an accusation. It's a request. You're inviting them into your reality.
Exactly. For the nurse, it could be, I need my healthcare team to see my color to understand my specific health risks.
You frame it as a matter of professional competence. You're helping them be better at their job.
Okay, I can see that working in the right context. But what if the situation is more serious? Or what if you're just done with being gentle? Sometimes it doesn't feel right to coddle someone's feelings. Then you move to strategy 2, clear boundary. This is more of a stage +3 or +4 response. Here, you're prioritizing truth over the other person's comfort. You're naming the harm directly.
This one feels like it takes more courage. What does this script sound like?
It's much more direct. Something like, when we say we don't see color, we make it impossible to see racism. For us to work together effectively, I need you to be able to engage with the reality of racial inequality.
Oof. We erase racism. That's a powerful, direct statement. No ambiguity there.
None. It reframes the entire conversation. It's no longer about, are you a nice person? It's about, are you equipped to deal with reality? It's a high-stakes move, but if you're a leader, sometimes you have to draw that line to set the culture for your whole team.
Okay, then there's the third option. And I think for a lot of people listening, this might be the most revolutionary one because this work is exhausting.
It is exhausting. And that's why there's strategy 3, protect and exit. This is a pure survival strategy.
And the framework says this is okay. It doesn't feel like a failure, like you're letting them get away with it.
Not only is it okay, Dr. Magadz calls it a survival-wise move.
So when do you use this one?
When the power imbalance is too great, like with your doctor or your boss. When you're just too tired to engage. When, from past experience, that this person is not open to learning. You are not obligated to offer a lesson to every person who says something ignorant.
I think so many people carry guilt about this. That feeling of, oh, I should have said something.
And this framework gives you permission to let go of that guilt.
Yeah.
Your primary responsibility in that moment is to your own safety and well-being, not to their education.
So how do you exit? What do you actually say?
You can say something that refocuses on the task at hand. For the medical appointment, the script is, I'd like to stay focused on my treatment today. I don't really have the energy to get into that right now, but I do want to note that that language doesn't land well with me.
That's so clean. It's not aggressive, but it's a clear boundary. It says, I'm here for a service, not a debate.
It signals, I heard you, I disagree, but this is not the time or place. It preserves your energy for the fights that actually matter to you. Or you can say nothing at all, get what you need, and leave. That is also a valid choice.
Looking at this whole map from -6 to +6 and these different strategies, it's a lot. It can feel really overwhelming, like it's impossible to fix everyone or even yourself.
It can. And that's why maybe the most compassionate part of the entire framework is the concept of the +1 shift.
A +1 shift. I like the sound of that. It sounds manageable.
That's exactly what it is. It's the antidote to feeling overwhelmed. The goal isn't to get from stage -2 all the way to stage +6 in one difficult conversation. The goal is just to move one step, just +1.
So for the person who said, I don't see color, the learner in stage -2, what's a +1 shift for them?
It might just be moving to stage -1 or stage 0. It's the flicker of realization. Oh, maybe my good intentions aren't the only thing that matters. Maybe there's an impact I wasn't aware of. That's it. That is a huge win.
You don't need them to become an anti-racist activist overnight.
Not at all. You just need them to move from denial into reality. If they can go from I don't see color to I'm actually really scared to talk about color because I don't want to say the wrong thing.
Yeah.
They've shifted from stage level 2 to stage 0. That's massive progress.
And what about for the person on the receiving end, the navigator? What does their +1 shift look like?
If you normally freeze up, if you're at stage 0 and just say nothing and then beat yourself up about it for days, a +1 shift might simply be rehearsing one of the scripts in your head after the fact, or just noticing your clenched jaw and consciously relaxing it. It doesn't mean you have to deliver a perfect speech. It just means you stayed a little more present with yourself.
That is so forgiving. It makes it feel possible. It's about small, sustainable, incremental progress.
It is. It frames this as a lifelong journey, not a final exam you have to ace every single time. A +1 shift is sustainable. Trying to make a +8 jump just leads to burnout.
So, to pull this all together for everyone listening, the big takeaway is that the phrase, I don't see color, isn't this harmless, nice thing to say. It's a marker of stage 9 to fatu, denial, and fragility.
And it prioritizes the speaker's comfort over the listener's reality, which, in contexts like healthcare, can be actively dangerous. It's not just impolite, it can be negligent.
We talked about the body check, that first step of listening to your own nervous system and regulating it before you do anything else.
Secure your own mask first.
And then choosing a response that matches your capacity in that moment. Gentle curiosity to call someone in, a clear boundary to name the harm, or protect and exit to keep yourself safe.
It's an incredible toolkit. It takes this really awkward, confusing, and often painful interaction, and it turns it into data.
Right. Instead of just feeling hurt or angry, you can get analytical.
You can step back and say, okay, that was a stage -2 comment. I'm feeling like I'm at stage +2 today. What are my options? It gives you agency. It gives you your power back.
You're not just a victim of the comment anymore. You're a navigator of the dynamic.
That's it, exactly.
So as we wrap this up, maybe a little bit of homework for you listening. The next time you encounter a comment like this or anything that gives you that feeling, just try the body check.
You don't even worry about what to say. Just notice, what does my body do? Does my stomach clench? Does my breath catch? Just get curious about your own response.
And then maybe try to identify it on the map. Just naming it in your own head, it's a stage make 3 comment, can be incredibly grounding.
It engages your thinking brain and can calm down that initial emotional flood.
And we want to leave you with one final provocative thought to chew on. If you are someone who has used the phrase, I don't see color, and again, no shame, this is a space for learning, just ask yourself this question honestly.
What were you trying to protect in that moment?
Were you really trying to protect the other person and make them feel safe? Or were you maybe trying to protect your own self-image as a good person? Because real safety, true connection, it requires being seen completely, not having parts of you erased for someone else's comfort.
We all deserve to be seen fully.
That is our deep dive on the myth of colorblindness. A huge thank you to the work of Dr. Shungu Hilda Magadza for this framework. It is such a gift.
The truly vital tool for navigating the world we live in.
Thanks for listening. We'll see you on the next deep dive.